pronounced dead on arrival. We currently have 5 patients in critical condition and 3 in serious condition. For members of the public who may be concerned that their loved ones were involved in this incident, you may contact our Family Information and Support Center. The telephone number is 416-480-4940. That's again 416-480-4940. Sunnybrook would like to thank the first responders, emergency medical services, police services, and the many teams in our hospital who have responded to this situation. Thank you.
Doctor, are any of the victims or any of the people you're treating right now children?
The victims that we have here are adults.
What can you tell us about the 2 people who succumbed to their injuries?
I don't have details about any of the injuries, either in the 2 individuals who were pronounced deceased or in the ones who are still receiving care at this time.
But they've been positively identified and their family has been notified, the 2 victims who are deceased?
Still in a process of identification and confirming identification. As I mentioned, if family members believe that they may have someone who's been impacted by this, there's a telephone number which I can read again at the end of the statement to contact if they wish further information or how they can proceed here to assist further.
Is the suspect one of those being treated inside? Is anyone in there in custody?
Not that I'm aware of.
Doctor, the hospital takes in about 1,000 trauma patients a year. You've had 10 today?
That's correct. So the 10 individuals who came in all came in as trauma patients with varying levels of injury.
Have you ever seen anything quite like this? This is a situation being described by an EMS supervisor, by police in the city as unprecedented.
The circumstances certainly are unprecedented, and I think it's a situation that we all prepare for. And as a regional trauma center, we practice, we drill for code orange procedures, and our teams were prepared. And I think they acted in an incredibly coordinated fashion to provide the care to the people that were brought to us today.
What does code orange mean?
A code orange is a situation where there's an external disaster or incident, where there's a number of individuals who are arriving at the hospital beyond the normal numbers, where we have to mobilize additional resources to manage the patients that are coming in.
When was the last time you would have had a code orange? This is almost unprecedented, as you've noted.
I'm not certain the last time Sunnybrook had a code orange. They do occur from time to time, and we sometimes prepare for an incident that fortunately in those circumstances doesn't turn out to be as serious as this one today. But fortunately our teams were prepared and were able to act today.
Dr. Katz, you said in the statement, you said 3 people were in serious condition. However, in the statement that we have here, it says 2 in serious condition, 1 in fair. Can you just clarify?
That's correct. The 1 individual in fair condition has been upgraded to serious. There's a question over here.
How many people have gone into surgery at this hour? How many patients have gone into surgery?
I don't have the numbers of who has gone to surgery and who has not at this point.
So, again,
do you have an age range of some of the people that you're treating?
I don't have ages right now. Some are not yet identified. I don't have ages.
So you have 5 people in critical.
Serious, that's correct?
The individual who was in fair condition initially was since upgraded to serious.
Can you give us any more detail about exactly how serious those are? Are they life-threatening? Are you worried about?
So certainly it's early in the process of their care. We want to make sure that we're able to assess all of their injuries before we make any sort of more definitive statement. But at this point, there's 5 that are the most seriously injured that are classified as critical, and three that are serious.
Doctor, the 5 that are in critical condition, what we've heard from witnesses is this is a van that literally drove through people. Can you discuss the nature of some of these serious injuries, please?
Well, I wasn't one of the care providers, so I couldn't speak to their injuries per se, but certainly there was a range of injuries, including some very serious injuries.
How many doctors and nurses
have you spoken to any of the families yet?
We're in the process of connecting with families. I know some have arrived and we've connected with. There's others that we have not yet.
What can you say about your conversations with them?
I've not been involved in the conversations with any of the family, so I couldn't really speak to that.
Can you speak to the mobilization of staff that you would have had to enable in a code orange?
Sure. So we got an initial pre-alert call shortly after this happened that there was a potential that we would be getting multiple patients. We activated our code orange response at that time, which is a system-wide response throughout the hospital. It involves teams, everyone from those working in the labs and blood bank to prepare our teams both in the emergency department and the ICU and the OR, but also on our floors to try to create space for patients that are coming in.
And what would numbers look like?
We have called in some additional critical care nurses to help manage the patients in the ICU area afterwards. The teams, we were fortunate in a way in the timing that this happened. This was during the middle of the day, and we had a large number of our staff and physicians that were already here, so we were able to manage the initial arrival of people in that way.
Doctor, 10 victims and patients, I should say, from the scene arrived here at hospital. I know the conditions vary. Did they all arrive by emergency run?
I believe they all came by EMS, yes.
And I know you can't say much about the 2 people who are deceased as you work to notify their families. Can you give us any indication as to age, gender?
I can't at this time.
Doctor, I know previously when the initial numbers came out that Sunnybrook was treating 7 individuals, it also mentioned that the hospital was sort of in its own kind of a lockdown as an abundance of precaution. Is that still in effect?
I believe the lockdown is still in effect, but I would have to confirm that. Certainly, the numbers change over time, as you can imagine in a situation like this. It's a very fluid situation. So when we initially were aware that there were 7, there were others that arrived subsequently, and as you can imagine, it's a little bit of organized chaos when situations like this happen. So it takes a while to be certain of the numbers, and we wanted to make sure that we had an accurate account before we went out.
But is the hospital still in lockdown?
I don't believe so. Are we still are for the time being.
And
sorry.
what does that mean?
It just preventing anyone from accessing the hospital or the emergency department that doesn't absolutely need to. It's also a means so that if families were to come to the emergency department, we're able to redirect them to our family information center and to try to connect them get information about the loved one that they're seeking.
So, Doctor, just to clarify, all the people that have come through this emergency ward this afternoon are those 10 people from the Young and Finch scene?
That's my understanding. That's my understanding. No, there are other individuals who have accessed the emergency department. So we're not turning away patients that are arriving, but for visitors, etc., that would be coming to the emergency department, we're restricting their access.
And we know that access to the campus in general was being controlled. Was that a request by police, and is that part of your protocol?
I don't know in this circumstance who initiated the decision to lock down. I mean, obviously, it's a circumstance where there was a lot of uncertainty initially in terms of exactly what had happened and what risk might be present. So it was an abundance of caution to try and keep our patients and our staff safe.
To be clear,